Hey, good morning. It's Chris with Maynard Dog Training Solutions. Let me get started here in a second. See what's going on up in here. Let me make sure this is on recording. We're on some live. Talk about some allergies and aggressive behaviors. So a lot of you have dogs that are itchy and scratchy. I'll start with those, mostly the skin allergies that I see the most of. And so what happens when a dog is itchy, scratchy, and all that kind of stuff, and irritable, they really show outward irritability in that you can't touch them. They don't want you near them. It's not that they don't love you. It's not that they don't necessarily want you to touch them. Well, maybe perhaps at that moment, they don't want you touching them. But you got to understand that a dog is not a being that has to be touched and pet all the time. You know, we humanize it so much that we think that we should be able to touch and cuddle our dogs and snuggle our dogs 24 hours a day. But I'm gonna tell you what, if you would just, even my own family, my own loved ones, you walk up and try to hug me when I'm not paying attention or something's going on or I'm busy in something, I don't want to be touched either. And that's how dogs are. So don't expect that your dog always needs to be touching, first of all. But now let's add some allergy stuff in there. Let's add some itching and scratching, some skin allergies kind of stuff. Now, not a vet. I'm not claiming to be a vet, but I am going to share with you some things about what I see when a dog shows some signs of aggression, especially in the allergy sense. When I have a dog that's irritable with allergies and is always scratching and digging out things, whether it be in their ears, a lot of dogs are just concentrating on their ears mostly because they have some sort of thing going on with their ears, or just in their skin. They don't want to be touched. So what happens? We go and try to snuggle them, we try to touch them, we try to do all these things with our dogs, and they don't want it. Well, how do they tell us that they don't want it? They can't speak English. They're not going to say, "Hey mom, hey dad, stop." No, they're going to give you a little push, a little lick, maybe a super extra lick. And in that case, you normally say, "Well, that's just them loving me." Well, no, that's them telling you to stop. Then they give you a little lifted up growl. It might not be actual growl. And then it goes on to the air snapping or things of that sort to just chase you off. And then it moves up to the actual biting. Now, dogs can go from 0 to 100 in that sequence, all in one go, right? So you start to touch them, they're super irritable, super itchy, they didn't sleep good last night. All of a sudden you go and touch them, and bang, you get bit. Or you have neighbors over, you have friends over, you have family over, and they're messing with your dog because you think your dog should be snuggly and cool, and they get bit, and you can't figure out why. This is out of nowhere. This is out of the blue. This is out of their character. No, it's not. It's a dog's character to let you know that they don't want you to touch them by biting you. That's how they talk. That's how they communicate. And you have to understand that dogs don't want to be touched all the time. Get over it. Love your dog. Show them some courtesy. If you have allergies, it's a very, very good idea to kind of just, minimize that health risk to them or that bite risk to the people, and just keep your dogs away from people when they have a lot of allergies going on. Now let's touch on some of the medication. I'm not going to go deep into it. Again, I'm not a veterinarian, but I see enough of it in the behavior world to know that some of this stuff is not so great in a situation where a dog may be a little edgy, a little grumbly. So with skin allergies especially, there are some medications out there, and I want you to check with your vet about it, that actually have side effects of aggression. So now check this out, right? If a medication is making your dog be a little more aggressive, and the itchiness is making your dog be aggressive, and let's say you already have an aggressive dog or a dog with aggressive behaviors, what do you think that's going to do? That's a recipe for disaster, right? So you need to be careful, you need to be cautious, and you need to be aware of what your dog needs are, what's going on with your dog and that sort of stuff. So allergies, nothing to be messed with. And again, if your dog is super itchy, scratching at ears, scratching at eyes, digging out the skin to where they bleed and that sort of stuff, you need to get it checked up, right? Not saying don't get medication. I'm saying you need to take care of it in a responsible way. So allergies, aggressive behaviors, very, very much linked to each other, as far as some allergy stuff may cause or may promote more aggressive behavior. So you got to be careful of that, especially if you already have an aggressive dog. So I think that's all I'm going to say about allergies and aggressive behaviors. I can tell you that my own dog, when she has some allergy issues going on, skin allergies, she digs them out. They start scratching, they get more itchy. And again, on survival is I have this thing that's itching on me, I want to get it off. So what do they try to do? They try to dig it out and get it off, right? They don't know that if they keep digging, they're going to scratch it open, they're going to bleed, it's going to itch more, it's going to be more damaging and that sort of stuff. And then of course the irritability goes up and up and up from there. So you need to be aware of that as well. So if you see your dog scratching or itching, get some help. They have oral medication. They also have, if I'm saying it correctly, the subcutaneous injections that you can get. That's what Freya gets now instead of the oral. But again, talk to your vet. Ask them what the best route is. And if you're seeing any kind of irritability or aggressive behaviors coming out of your dog, just give us a shout. You know, we can help you out with that. We can show you how to manage it, how to keep people safe, set things up so that people aren't getting bit and that sort of stuff. We don't just come out and make your dog sit like some of these companies that are out there. You know, they're great at making your dog sit. That's great. But what about all the behaviors that I'm having and why am I having them? That's when we come out and we take care of the issues. We want to get down to the root cause. So when we come out, we do a pretty detailed intake. You know, get some questions about, you know, what's your dog eating? When does your dog eat? What's the family dynamic? Who's around your dog? Who's not around your dog? You know, what's the exercise schedule like? All that kind of stuff. So we really get deep into what's going on with your dog and how to take care of the problems that we're seeing. I think that'd be all. Who's on here? Hey, Valerie, I see you on there. Thanks for joining. Let's see. Who else is on here? Oh, I just ruined something. Here we go. Let's go back to this. Somehow I just cleared out of this thing. Come on back. Here we go. Okay, I'm back. So yeah, allergies in dogs. Serious stuff. Make sure you get with a vet. If you're unsure, if you live in Rhode Island, Massachusetts, and you're looking for a vet or you need to get some health care, you can also reach out to us. We work with a lot of different veterinarians. We know what's going on and who's around and who's not and who's taking care of dogs and what their specialties are, because all vets are different, of course, and they run things differently. And of course, depending on your personality and their personality, we want to see who fits the best, of course. Carrie, hey, what's going on? Thanks for joining. Let's see. Allergies. Medication-wise, we talked about, you know, the interactions between the side effects and itchiness and irritability. And then, of course, we talked about aggressive behaviors already being there. So if your dog already has aggressive behaviors, it's going to make it a little bit worse when your dog has some allergy issues. Now, I'm going to go off track a little bit here with allergies. Sometimes you're going to go to your vet and you're going to say, my dog's itchy. And they're going to say, okay, why don't you change the food? Because they're allergic to XYZ food with protein, whatever it may be. I'm not saying your dog isn't allergic, but what I'm telling you is, if someone says that your dog has allergies, but they haven't tested for the allergies, but they're going to give you a solution for it, maybe we should question a little bit more. Maybe we should get a second opinion. It's not always what they think it is. You know, they always have a go-to. I hear a go-to a lot is chicken. Yeah, a lot of dogs are allergic to chicken. A lot of dogs are allergic to poultry, indeed. However, when anyone's jumping straight to the chicken thing, you know, it'd be better off that you get an actual allergy test. Depending on where you live, it's $400 or $500, maybe more, maybe less, to get a full panel done. And so, you know, getting those allergy tests done to see what your dog is actually allergic to is actually going to minimize all of that stuff that comes on, you know, digestive issues, skin issues, eye issues, that sort of stuff. Again, not a vet, not claiming to be a vet, just showing you and telling you what I see out there. Very good idea to get an allergy test with your veterinarian. That way you can eliminate the things that may be making them itchy. And so again, that's where the source comes in. We're always about trying to solve the source of the problem rather than just making your dog come to you and sit with you and go to their crate and all that kind of stuff. We want to solve issues, not just take care of the outside, the symptoms, what have you. All right, guys, thanks for joining. That's it for allergies and aggressive behaviors. I got a workshop to do here at 10 o'clock for a group of Kanuku friends, and I'll probably be back on here later. But thanks for joining. I'll see you guys.